Good morning, everybody. My name is Trine Mikkelsen. I'm talking to you here on Facebook Live from Montreal, where I'm a yoga therapist and I focus on menstrual health and specifically endometriosis and infertility that often comes with that condition and many similar conditions. I spent the morning looking in different support groups. There's luckily so many support groups now for pelvic pain, endometriosis, infertility, menstrual imbalances, and a lot of the questions and a lot of what we share in these support groups are the pain, how to deal with the pain. And it's heartbreaking. Like you might see I have little red eyes because it makes me cry to read about the huge amount of pain that comes with these conditions, both physical pain and emotional pain. The physical pain and the hopelessness often creates depression, anxiety, fear. When we're in that much pain, survival mode kicks in, and there's a real fear around how to deal with the pain and how to live our lives the way we hope to live them, how to live a full life, and if that's even possible. I was even reading a post from a girl, and I can so relate to this, talking about the pain that comes with making love, that sense of being in a situation where allowing ourselves to be in that beautiful connection with a partner and allowing ourselves the pleasure, but knowing that with that pleasure potentially comes a huge amount of pain after. Like how to balance that, how to step into life knowing that making love to your partner or going grocery shopping or going to a party and dance out might mean that 2-3 days after you're going to be in pain. And how do you then still step in to life at its fullest without that fear of is there going to be a price to pay here? So I wanted to, this is a very personal subject for me too. Luckily I'm not experiencing that kind of pain anymore, but I used to be in that kind of pain, and I used to be in situations where I would be the pain would be so strong that it would be hard for me to walk. Like I'm sure you know that feeling that you're in so much pain and your legs give in, like your legs are shivering, there's no strength in your legs or your hands, your arms, you get diarrhea, like your bowel stops, and it's scary. And I would need my partner to sometimes carry me from the bed after lovemaking to the toilet to help me deal with the nausea. And it really isn't a way to to end a beautiful romantic situation. It's not the kind of pillow talk that you want to be having in the bathroom curled over in pain. And when we experience that kind of pain, it's very natural that we want to push away. We want to disconnect from that pain. It's a very natural reaction, and sometimes the best thing to do is to rely on pain medicine, if at least to get that sense of a little bit of ease, so that our muscles can relax and our heart rate can come down and we can move out of fear mode. But it's also very important to remember that pain medicine doesn't really cure what's going on. It in some ways allows us to relax, but it also disconnects us a little bit. So even when taking that pain medication, to make sure that you still are very aware that something is going on in your body that you need to take responsibility for and connect to. And today I'm going to talk about something that might seem like an impossible thing to do when you are in pain due to your menstruation. And oh, my phone's talking to me here. And that is to allow yourself to do the opposite of walking away or disconnecting. And for a moment, allow yourself to step closer to that pain. And depending on the severity of the pain, you might not be able to do it for long, but before reaching for the medicine, allow yourself a moment to close your eyes and step closer to that pain. Explore that pain. Breathe into it. And have a sense of listening to the pain. We're going to do a meditation, a visualization in a few minutes. Well, I'll take you through some steps where you can do that. Because it's been proven that meditating, visualization, and breathing put together can bring pain down, especially pain in connection to menstrual cramping and pain in the womb. Can bring it down to 58% approximately. We all have different bodies, so it's worth trying. Instead of pushing away, tightening up, disconnecting, fighting the pain, I want you to explore what happens when you step into it and listen. Now, I have a 4-year-old daughter, and for anyone who's a parent or have been around children, you know that when children are in pain, right from the moment we come out of our womb, our mother's womb, our only means of communication until we get language is to cry, and that cry of pain can mean so many things. And as mothers, when we take the time to listen to that cry, and when the kids get older and they have full-on meltdowns, listening to that cry, connecting to it, giving it our full attention, calms it down immediately. And that's the same with our bodies. Our bodies don't have language in the sense that it can communicate us with words, but it has pain or pleasure. Those are the two ways that we can communicate with our bodies. And when our bodies are trying to communicate something, it either does it with pleasure, wow, this feels good, or with pain, this does not feel good. And that pain comes with a message. And we want to listen to that message, because really to move through that pain, the only way is moving through it, taking that moment to listen. So we're going to practice that a little later. And it really is to make a decision. And I want you to just try it out and not take my word for it. It really is to decide whether that pain is our enemy or our friend. Do we want to fight it? Or do we want to befriend it? Can we take that pain out for tea? Can we listen to it? Can we allow it to come closer to us? Can we explore, what it feels like and what might be the message in it? And hold it as long as it's possible, breathing into it as long as it's doable. And if you get to the point where you're like in cold sweats and you're shaking, breathing into that cold sweat, breathing into that shaking, breathing into that pain, using your breath to expand and calm it. And then when you can't do it anymore, then take the pain medicine. Allow that support for yourself, but keep exploring and feeling what happens as the pain medicine kicks in, as that relaxation happens. Keep connecting to that pain in your pelvic, even though that it's now lessened. Don't just get up and run away and say, oh, everything's fixed now. Stay with it. And I really want you to write to me, once you've tried this practice, and see what happened. Our body, I believe, is our friend, always trying to tell us what's going on, to support us with that pain, to bring us back. And yoga is about awareness. Ultimately, it's about getting closer to ourselves, to expand our ability to be aware and to feel into. And we know the full-blown spectrum of pain, but we also know the little signals. I'm eating this and it makes me feel groggy, or what I'm doing this when I run this fast for this long, something tenses up. Or if I'm in this situation at work or with this person, I feel agitated after. There's lots of little sickness that happens all the time. Our bodies communicate to us all the time. Our emotional imbalances communicate to us all the time. So when you get into those moments where you're being overwhelmed physically or emotionally, with pain, next time, stop what you're doing, if you at all can, lie down, sit down somewhere comfortably, listen to it, move closer to it. And then let me know what comes up when you do that. Okay, so no further ado. I want to bring yourself to a comfortable sitting position. And I like to sit on something, a bolster, or something where I can come up a little higher. So if you're sitting supported in a sofa or on a chair, it's also nice to have something to support your low back. So you want to be able to, or you can lie down. I want you to be able to fully relax, so you're not feeling that you're having to hold your legs or you back up. And often a good little rule is to have a way where your knees are below your hips. So if you're sitting, you want to be able to sit in a way your knees are below your hips. You can see here that, we tend to, want to be doing this. But as I bring my knees down, and you actually tilts my hips and my pelvic region. And as I slide out right to the edge of this bolster, I don't know if you can see it, right to the edge of this bolster, I naturally create this little curve by tilting my hips and moving my sit bones back so I can relax on my sit bones. And then I get this beautiful, nice straight back and a nice open chest. My heart naturally comes forward, there's room to breathe. And I'm not, using my muscles to hold this. It happens naturally. So take the time to sit up, like to literally create a sense of a foundation for yourself, so that you are supported. I was talking about this example earlier about the mothering, like being a mother to children. But the thing is that before we start mothering our children or potentially becoming mothers, what I have found is very important to be the mother that I want to be, is to learn to mother myself. All women, with kids or no kids, without partners or with partners, without parents to take care of or not, we have this innate ability to mother. It comes with being female. And I think for healing to happen, especially healing when it comes to our womb, is to tap into that ability to mother, to really deeply care, to put our bodies and ourselves first. What would that be like? So when you're in pain, if you were to mother that pain, what would you do? If that pain was not internally, but within a child in front of you, how would you react to it? What kind of mother would you be to that pain? Would you stick that kid some Advil and tell it to go to daycare and keep running? Or would you allow that kid the time and the love and the attention to deal with whatever's going on? So every time we mother ourselves, it's not a waste of time. There's so much healing that happens in that. There's so much action that happens in that inaction of stopping and listening and caring. Okay, so come to that comfortable sitting position. And closing your eyes. And I'm going to keep mine open, and I'm going to keep talking to you. But I want you to close your eyes wherever you are lying or sitting. I'm going to come a little closer so you can hear me. So, closing your eyes. And take a moment to bring your awareness, just simply allowing your mind to rest on your breath. Breathing in and breathing out. You don't have to change your breath or alter it. You just want to let your mind rest on the breath. And every time you breathe out, allow that out breath to deepen your relaxation. So every time you breathe out, you calm down a little more. You rest into your body. And there's a transition here from being in the world, from being outward to going inward. So So being aware of that transition. So at this point you might be aware of, the bolster or the chair underneath you or the bed or the sofa that you're lying on. You might be aware of the sounds around you. You can hear and feel your breath. So you're already using your sense of touch and your sense of sound outwardly. Now I want you to bring that sense of your senses inward. So your sense of touch starts to connecting with your internal body. Your sense of listening starts to connect to your internal body. Your sense of sight starts going internally. So first, you're just going to bring your senses to your breath. See it moving inward. As you breathe in, that sense of breath comes in through your nose. It moves into your body. See where it goes. As you breathe in, where does that breath go? And what happens as you breathe out? And feel it. What does it feel like? As you breathe in, your breath is a little bit colder as it comes in through the nose. And as you breathe out, it's a little bit warmer. How does it feel as the air enters your body? What happens in your body as you breathe in? And what does it feel like to breathe out? Now allow yourself to lengthen your breath. So you want to expand it to its full capacity. You want it to reach into all the little nooks and cracks and all the cells of your body. So you want to breathe deeper. Let the breath move all the way into your pelvic region, into your low back, all the way up under your collarbones. Feel the breath moving to the back of your body, the front of your body. Feel like sense of expansion that happens as you breathe in. You expand out. You expand down, you expand up, you expand to the sides, front and back. And that natural in-breath creates a sense of space. Within itself, space is created. And feel how as you breathe out, you can relax and rest into that space. Take that space. Settle into it. And then start exploring your body. Check in to see how your body feels right now as you're breathing. Simply breathing in and out. Where do you sense tension? The outer tension of the muscles in our shoulders, neck, maybe in your face, your back, your legs. But also sensing a sense of the inner tension. Our organs hold tension too. Tension that can be in a heavy heart. Tension that fear can create. The tension that severe cramping in the uterus can create. Take a moment to breathe into those parts of your body where you feel you hold tension. And allow that in-breath to create some space around the tension. And as you breathe out, with every out-breath, release a little bit more of it. Relax a little bit more of the tension. And if this is a day where you're feeling extreme amount of pelvic pain, or a lot of anxiety and depression, or both. As you relax, that pain will feel bigger and stronger. Because as we relax, we feel everything much more. A lot of our running around is ultimately a way of trying to run away from discomfort. So I'm asking you to be brave now and to step into that discomfort. Or at least just use your inner eyes to look at it, maybe from a little bit of a distance to start with. Look at that pain. Feel the pain. Breathe into it. And then start a sense of a conversation with the discomfort, a conversation with the pain. In your own words, speaking quietly to yourself. Let the pain know that you come as a friend, that you might not always have been there, but you are there now. That the pain have your full attention, that it's safe, that you're here to listen and to understand and to help the pain in any way that you can. That you want the two of you to walk forward in this healing process together, not as enemies, not in a fight, but in love and understanding. That it's a democracy, that you want to move forward agreeing. So to start this conversation, you just want to explore it with your senses. So take a moment to see the pain. What color does it have? Does it have a color? Where is it situated? What size is it? Does it move? Or is it in one place? Does it want to move? What does it look like? What images come up? And you might also have memories come up or images that doesn't make any sense in the moment. Just keep watching, being present. And then try and feel it. What does it feel like? Is it warm? Is it cold? Does it radiate out? Or does it stay real tight? Does it have a sense of a shape shifting? Is it like sharp edges, or is it like a soft, round? Is it fire or is it frozen? Take note of all of these things. Right now you don't have to do anything but just be aware, stepping a little bit closer all the time. And then bring in that inner ear of listening. And you might ask it questions. Ask the pain, What are you trying to tell me? What do I need to know? How can I help? And right now, you might still be on the outskirts, looking at it. Or you might have stepped all the way in at this point, sitting in the center of the pain. Like sitting in the middle of the whirlwind. Or maybe it's completely calm at the center. Sitting still with the pain, using all your senses, being completely present, listening the way you would listen to a good friend who's asked you out for tea because that friend has something that it really wants to share. And sit with this as long as it feels comfortable, breathing into it. With every in-breath, have that sense of having your awareness expand, your space expanding, creating space for that pain to have. It's so used to being packed away or numbed. Allow it to take the amount of space that it needs for a moment. And then every time you breathe out, allow that out-breath to ease, to soothe, to release. When we release tension, it's usually like peeling an onion. It takes a while and we're peeling away layers and layers of tension. Tension that's been held for weeks or months or decades sometimes. And whenever you do this visualization and this breathing exercise, if things get too much, allow yourself to step out a little bit and just bring your awareness back to your breath. And then when you feel ready, you step back in. Because it can feel scary. Often our pain is something that we've been scared of for years. And within that pain, there's so many emotions or memories or things that, we've been trying to disconnect from. So it's totally normal that once you step in like this, things start moving, things start flowing. You might be crying, things are being released. Just with the breathing into the pain, tension is being released. And within that tension, there can be so many layers. So that's totally normal to move through that. And to create a little dance where you might be stepping in and moving back. Don't push yourself in any way. Do this with a lot of love and compassion. Like a mother, and with a lot of patience. Now I want you to use your imagination now to imagine that all around you you see brilliant white light. And then every time you breathe in, you're breathing in that bright white light into your body. Every in-breath, the light settles into every cell of your body, every level of your consciousness. So you're breathing in the light, and you start filling yourself up from your feet, all the way up through your legs, like a glass vessel being filled with water. You're filling your body up through your pelvic region, your chest, shoulders. It's pouring into your hands and arms all the way up into your head, your mind. See yourself being filled with brilliant white, warm, healing light. Every time you breathe out, this light settles. See it settling and filling your uterus, your ovaries, your pelvic region, your low back. See that area being nourished and cared for, receiving what it needs right now, whatever that might be. And see it filling your heart. See the light settling in your heart and radiating out from your heart. See it wrapping around you, inside and all around. So you're in a cocoon of light that protects you, that's always there for you. Allow yourself to focus on the breath and the light, and let that fill you instead of the pain. So allow the light for a moment to take the space in your head, in your mind, and in your body. And see what happens when you do that. When you have put yourself now into this perfect position of being as relaxed as possible, fully connected to your body, to your breath, to the pain, supported by the light. How does your body react to this? And I want you to stay with this as long as it feels comfortable, as long as you need. Some days it might just be 5 minutes, other days it might be half an hour. And if possible, to do this little practice every day. And especially on those days where you're feeling a lot of physical or emotional pain, take that time to step into it. Have that courage. Honor the message from your body that's within that pain. Take the time. Be with it, just like you would with a child. Be aware of whatever memories or thoughts or feelings that come up. And when you feel ready, you very gently start transitioning back into the world around you. And just the way we came in, you can do the same thing as you come out. Have that sense of moving all your senses, your sense of touch and sight and hearing outwardly. Feeling that support you're sitting on or lying on again. Hearing the sounds around you. Opening your eyes. Getting yourself used to the surroundings again. And for a moment you're in this perfect position where you're very connected inwardly, and at the same time you're in the world. And that's the ultimate goal, that we can walk through life, through our day-to-day life, being very present outside ourselves, but at the same time being present with ourselves. And then take a moment to write down whatever came up. So write down what your pain was telling you, what it looked like, what happened, what memories came up, what the pain was telling you, how you could support it. Do this every time, so you're starting this conversation. And you'll find that you can start asking all kinds of questions to your body and your pain. And you will get an answer. And you will follow those answers. And you'll put them into place in your life. And then you will keep moving forward that way. And when it gets too much, allow yourself to have the support. Always allow yourself the support. Whatever that might look like. Be it pain medicine, or your friends and family, having that trusted family doctor. You know, it's not an all or nothing. But never stop being there for yourself. And please share with me what comes up. You can send it to me in a private message, or share with me if you want to support others. Share it with me underneath the video here. And promise yourself that for the next week, this will be your homework, to be a mother to yourself and be present. Listen to that pain. Take good care, always. Namaste. Hej Lone, det er dejligt at se dig. Hej hej.